Hey guys, today we're going to talk about how to identify nutritional deficiencies when you're doing OMAD, 1 meal a day. Okay. Now, a couple things. What we're talking about is subclinical deficiencies, not like a major classical deficiency where you have like B1 beriberi or pellagra or scurvy with vitamin C deficiencies. We're talking about the first sign of a symptom from a deficiency of a nutrient. Okay. Well, what would that look like? Now, by the way, I recommend the healthy version of ketosis, okay? It's in this book. Get the book, read it. I explain how to do it. Also, you're going to combine intermittent fasting. The need for nutrients goes down when you do intermittent fasting, okay? So you don't need as much, so that's good. So you don't really need to follow exactly the RDAs, but what I'm going to show you now will kind of give you some good clues on if you are starting to become deficient. Okay. Now, if you're deficient in vitamin B1, the first symptom would be fatigue and especially nervous energy, like this nervous anxiety, this pressure that builds up. You can't relax. You want to strangle someone. Okay. All right. B2, oily skin, and then flaky skin, and then the list goes on and on and on. Okay. B3, moody, depressed. It's the same thing with vitamin B6, moody and depressed, because these two nutrients are involved in the production of a protein, basically neurotransmitters, okay? And neurotransmitters affect your mood. If you're deficient in B5, one of the first symptoms would be fatigue. Why? Because vitamin B5 is needed for the adrenals. And then we have biotin, which is in the B vitamin family, hair loss and split ends. Inositol. This is in the family of the B vitamins as well. And you get these red eyes, okay, or irritated. The surface of your eye gets irritated. Underneath the lids of the eyes, they're red. Now, this could also be a blood sugar problem, but it just so happens that inositol is involved with blood sugars. In fact, inositol as a nutrient, as a vitamin, is actually a sweet vitamin. It's very similar to glucose, but it's not. It's a vitamin. B12, red, swollen tongue. But there's many other symptoms you can get. Okay, the first sign that you're vitamin A deficiency is you can't see in the dark. So you're driving and you're not able to adapt readily to seeing in the dark. So that would be an indication you need more vitamin A. Okay, vitamin C, bleeding gums. So you're brushing your teeth and you notice some blood. Also, if the gums are swollen. All right, vitamin D deficiency, bone pain, like deep pain in your hip or your leg or wherever. And you're feeling kind of down. You have the blues. You see this in the winter months because of vitamin D. Okay, vitamin E deficiency. The first one is muscle weakness. So let's say, for example, you're going to go to the gym and you're going to work out, right? And you just can't seem to get enough energy or momentum because your body is just physically weak. It could be a vitamin E deficiency. Also, could be a sodium deficiency because it has very similar symptoms. Okay, you might just need more salt. Okay, vitamin K1 deficiency. You bleed easily. Let's say you bump your elbow on the door or something and you just start bleeding. Okay, that's vitamin K1. Guess where you get vitamin K1? Leafy greens. Surprise. Okay, vitamin K2. This controls the calcium out of the arteries and also out of the joints. So one of the first symptoms is stiffness. It's calcium building up in the joints. Okay, one of the first symptoms of a potassium deficiency is high pulse rate. And by the way, sugar cravings. But if you're on keto, you probably don't have sugar cravings. But higher pulse rate and eventually high blood pressure. And then arrhythmias. Magnesium deficiency, overall tight muscles, tense. You don't go to bed very easily. Your body is just very, very tight and rigid. And then I also mentioned sodium, feeling weak. All right, what's the moral of the story? It is don't waste your meals on low quality food. All right, get the book, do keto healthily, and you won't have nutritional deficiencies. All right, I'll see you later. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications. Daily notifications, that sounds weird. Well, I'll just remind you on a daily basis. How about that?